Hi, my name is Olivia Johnson, and I am presenting our work on Litchi as medicine, a critical analysis of anti-cancer potential. To give you a brief introduction, Litchi is a tropical fruit-bearing tree of the Sapindaceae family and indigenous to Southeast Asia, and is cultivated and consumed all around the world. While the many antioxidant, antiviral, and antimicrobial effects of Litchi have been studied, an up-to-date comprehensive review on Litchi's specific role in cancer prevention and intervention has, to our best knowledge, not been studied. This is what we decided to investigate in this study. Regarding methodology, we specifically used the PRISMA criteria to access and screen for literature from major databases such as PubMed, ScienceDirect, and Scopus, and after a rigorous exclusion process, we arrived at a total of 26 studies consisting of 23 in vitro and 7 in vivo studies that were then further analyzed. A brief look at Table 1 and Table 2 shows the constituents that are derived from various parts of the lychee, such as the pericarp, seed, leaf, and more, and you can also see that many different cancers were represented, such as liver, cervical, breast, lung, and prostate cancer. Looking at Figure 3, this shows a holistic view of our findings, detailing the many mechanisms of studied lychee constituents and its impact on various cellular pathways. What is quite evident is how various constituents work at different stages of key cellular processes, such as growth factor receptor-mediated proliferation, the different proteins involved in apoptosis, and the numerous proteins and stages of the cell cycle. A quick look at Figure 4 reveals the large diversity in the chemical classes and structures of these different individual lychee components. No surprise given how diverse the mechanisms and functions of these constituents are, as shown in the previous figure. In vitro, lychee constituents collectively inhibited cell proliferation, induced cytotoxicity, triggered apoptosis, and promoted autophagy. In vivo, lychee constituents collectively reduced tumor size and volume and suppressed metastasis. So our data shows that lychee constituents have significant anti-cancer attributes mediated by multiple central cellular mechanisms across multiple types of cancers. And this is exciting, as it highlights the potential for lychee as an agent for cancer prevention and treatment. Some challenges that we faced are that a predominance of in vitro studies of lychee's anti-cancer properties, roughly 5 times more in vitro than the in vivo studies. These in vitro mechanisms may not translate directly over to animal models. Another challenge is that there is a lack of studies investigating lychee constituent anti-cancer effects in human patients or in a clinical setting. Regarding future research, it would be helpful to research expanding areas of need, such as in vivo and clinical studies. We'd also like to investigate understudied cancers so far, such as brain cancers, skin, sarcomas, and leukemias. In conclusion, lychee-derived products and phytochemicals show encouraging promise for cancer prevention and treatment. Nevertheless, additional research, especially mechanism-based in vivo research and clinical studies, are necessary before the lychee can be used for human cancer prevention and therapy. Thank you.